And Margaret Harris, who speaks for the World Health Organization, is on the line from Geneva. Good morning to you.
Good morning, Justin.
Give us a sense from your headquarters this morning of where the world is.
Where the world is we want the world to be taking action. So we're asking the world to have every hospital, every health worker supplied with the protection, the knowledge, the ability to recognise the illness and protect themselves from getting the illness. We're seeing far too many health workers at the moment being infected, far too many young health workers dying. The epicenter, as you know, has really shifted to Europe. So European governments must be now considering how they can ensure that every hospital, every health service has got the capacity, can look after the expected increase in number of people they'll have to look after.
The scientific advisors here in the UK set great store by what they call herd immunity, this sense that actually quite a lot of people getting the virus will be good in the long term because it means that it won't go on infecting people. Is that something that the WHO approves of, believes in?
We don't know enough about the science of this virus. It hasn't been in our population for long enough for us to know what it does in immunological terms. Every virus actually functions differently in your body and stimulates a different immunological profile. So we can talk theories, but at the moment we're really facing a situation where we've got to look at action.
Right, so you are not convinced that herd immunity would even be a thing?
We're convinced right now, actually, that the main focus has to be protecting your health workers, protecting your health services, making sure everybody in your community is mobilised and understands what they need to do.
And does that mean banning large gatherings? Because the British government said in recent days that it wasn't going to do that, but is now, we understand, considering it doing it from next weekend. Would you like to see it done now?
That's one strategy, but it's not the only strategy. So the danger can be that people focus simply on banning large gatherings and not looking at the other things that must be done, like testing, like helping people to understand what else they can do to protect themselves, all the hygiene measures that we've been going on and on about that I've been boring you all with. All those other things must be done. It's the problem can be, people either look at closing borders, stopping flights, and as the one thing. We want all the things you need to do to be done together.
Right. And does that include closing borders? Because it's happening around Europe, isn't it? Not just the United States.
We certainly don't advise travel restrictions, and we're concerned about flight stopping because we need to be able to transport things in and out. We've been shipping vast amounts of personal protective equipment to I think 56 countries, and we've sent 1.5 million diagnostic tests to 120 countries. Those things only get there if transport's still working.
Yeah. You mentioned testing and the importance of testing. Another thing that Britain is having to grapple with is the extent to which it is possible to test all of those who think they are ill as a result of the virus. How important, in the view of the WHO, is it that everyone who thinks that they are ill with it gets a test?
Testing is the gold standard for identifying where your virus is. If you know this is not an easy illness to pick. It doesn't have the most obvious symptoms, as has been widely discussed, that it starts looking like any other respiratory virus. So people start with a fever, they start with a cough. But unless you know that someone's infectious, you can't then identify the people around them that may have already come into contact, and you can't help the people around them to protect themselves. So that's why we put such an emphasis on testing.
But I suppose there reaches a point where you just think, well, actually, we've got to just concentrate all our efforts on helping people who are ill, and we will think in the longer term, perhaps through finding out who's been exposed to the virus, about the numbers that got it. At the moment, the focus can only be on those who are ill.
It's got to be on all those things, because remember, if you get a huge outbreak like Italy, you will have 10 to 15% of the people who are infected needing long-term intensive care, needing ventilation, needing round-the-clock medical and nursing care, the involvement of the ambulance services, all the ancillary workers. They will be having to do this for weeks and weeks and weeks. You'll get to a point like Italy where there will not be room, there will not be space in the intensive care, and you'll be forcing medical workers to make terrible decisions. And no medical worker ever signed up to decide who lives and who dies.
Margaret Harris from the WHO. Thank you very much.